call the meeting to order. Rebecca, please call the roll.
Loin.
Here.
Hallie.
Yes.
Anderson.
Yes.
Candy.
Yes.
Rasmussen.
Yes.
Pam.
Yes, but I abstained from the October 26 minutes.
Okay. Toohill.
Yes.
Okay, are there any changes to the agenda tonight? Not, let's go to the consent agenda. Approval of the minutes of the October 26, 2020 council meeting. Approval of October 30th, 2020 payroll in the amount of $129,393.58. Acceptance of the Economic Development Committee minutes of 10/26/20. Approval of the September finance report. Resolution authorizing funds transfers. Resolution of employment in the water department. Approval of total claims in the amount of $911,927.27. Claims over $75,000 include Maxwell Construction of $86,254.78, Motorola Solutions of $86,365.80, PKG Contracting $528,767.47.
Motion to approve consent agenda?
Thank you.
Second.
Okay, moved by Gandy, second by Rasmussen. Any other discussion or questions? Not, please call the roll.
Gandy.
Yes.
Rasmussen.
Yes.
Toohill.
Yes.
Anderson.
Yes.
Pam.
Yes.
Loin.
Yes.
Hallie.
Yes.
Thank you. Tonight we have two public appearances. The first one will be John Loin regarding an outstanding bill.
Do you want the long, good evening. Do you want the long version or the short version? I did some work for a customer on North Court Street, and I went to Darrell City Department and needed a, what would you call it, a barricade, a flashing barricade. And in the past, I used equipment from the city before and thought nothing of it, and so I went and filled out a permit, signed my name to it, and used it for about a week. In the meantime, I had to go to deliver a truck to California. When I came back, I returned the barricade back to Darrell, and he said, "Oh, by the way, you owe $360." And after I picked my jaw up off the ground, I asked why. He said, "Well, we changed the policy and it's now $20 a day." I never paid anything in the past, so you can imagine I was pretty shocked when he said I owed $360 for a barricade that I used for 1 week. So I went to Aaron. Aaron said, "I can't do anything for you. Come plead your case before the city council." My compromise is to pay for what I used, which I really don't want to do, but I think it's a reasonable compromise of $140, and I brought my checkbook with me just in case. So that's the story.
Questions, council? To John?
So when you went to get the barricade, you weren't informed of the rates? There was no sheet of
Oh,
paper?
it
There
was-
was no sign-out
Oh,
process?
it was on there. Oh, sure. It
Okay.
was clearly on there. And I never thought twice about it because I'd never paid anything in the past. And when I went to the city, Dawn pointed out to me, there it is right in front of you. And sure enough, it's there. But I never even thought twice about it. So, because I never paid anything in the past. 'Cause I've done street repairs over the years and never had to pay anything. So,
You mean when you came back late with it, or you got charged extra money because you had it?
no, I got charged, period.
Oh, you have never been charged in the past,
No.
ever?
No, ever. No, but they changed what Daryl said is they changed the policy about a year ago. I haven't done anything in the past year, so I wasn't aware of the changes. They just assumed that I knew. It's a good lesson in reading the contracts, but why, if you haven't paid anything in the past and nobody says anything to you, why would you think that you needed to pay anything?
So you signed a contract in the past, but that was just in case you damaged it.
Damaged it, yeah.
John, don't you think, shouldn't you have read the contract?
Yeah, sure. Yeah.
Did you read the contract?
No. I filled out the necessary information. You have to give the direction of where you're gonna use the barricade and the homeowner's name and so forth. I filled all that out. Right below the first part of the contract it says $20 per day. Never even looked at it, never even thought twice about it. I was in a hurry. I'm always in a hurry, and so I never even read it. Filled out the information, signed it, gave it to Dawn, and that was it. Went on my way, picked up the barricade, and
So are you saying that the notice in the contract isn't sufficient notice? You should be told something else?
well, so if I hadn't paid anything in the past and they changed the policy, I wasn't aware of it. Nobody said anything. Dawn didn't say anything. Daryl didn't say anything when I picked it up. Actually, probably Daryl wasn't there when I picked it up. He left it outside of his office. So I wasn't aware of it. I certainly wouldn't have left it for 18 days. That would be pretty stupid.
But you said you were aware of it because you saw it, you read it. I mean, no, you saw it. You saw it, you just didn't think about it.
I saw it when I came back and Don pointed it out to me. And I said, yep, you're right, it's there. But obviously, if I would have saw that ahead of time, I would have, it probably was less than 7 days. I probably would have bought it back in 6 days. So my compromise is to pay $20 a day as opposed to $360 for a little 4-foot barricade, which seems pretty excessive.
You can make something for that cost.
I could.
What's your pleasure, council? You want to
My
compromise?
concern
I'm
is,
thinking the same way Paul is. Like, as a lawyer, like, well, you signed it. And
Yeah,
how do we
right, I
know
did.
you didn't know what you signed? Anybody can come back and say, I didn't read what I signed. Give me my money back.
Right.
We're beholden to the ordinance that we put in place that
Sure.
assigns a fee, and it's
Sure.
$20 a day.
Yep,
Times how many days.
right.
I don't know what we could do. I mean,
You can compromise.
I don't know. I don't know if we're allowed to go against our own ordinance like that. It says $1 amount per day.
the problem I would have, John, is if someone else could say the same thing. It's on the agreement. You have notice. You didn't make notice of the words in the agreement. It happens.
Why-
But you're asking us as a city to absorb the loss because you didn't read what we gave you to read in order to enter into an agreement with the city.
Absorb the loss.
Isn't that what you're asking?
Well, okay, it's a barricade. The reason they put that into effect is because people weren't returning things. I've never done that. No one ever said anything to me about it. So I'm just asking for a compromise, that's all.
You do this regularly, right? How many
Yeah,
times a year
yeah.
do you?
And I
in
did
the
it, I
past?
did it twice after this, but I didn't go to the city and ask for their
Right.
equipment. I got it from another
I guess
contractor.
I feel if you're in business with customers who are regular customers and you change your fee schedule, isn't it normal practice to inform people more directly that fee schedule is being changed instead of putting it into writing in small print and expecting them to find it?
Yes, but if it's been over a year, how long do they have to keep informing people? They don't know the last time you rented one, really. I mean, how long do you go? How long do you go if it's over a year?
Yeah, I don't know.
How long do you keep informing people?
First time they come in.
I get
But
both
you
sides
can't
of
keep
it.
track of that.
Well, to me, it's reasonable to point it out every time.
That there's a fee.
Yep.
Well, normally you would have it posted, right? If I go in and get my haircut, there's a schedule on the wall what the costs are.
Not where ladies get their hair cut.
It's on the
But I
form
assume
you
on
sign.
that
It's
basis.
on, clearly on the form.
I'd say it's not small print. It's probably about 18 or-
It was small enough that I didn't see it. I didn't look for it.
Okay, it's probably 11 point times new
probably at
road or
least
something.
12.
Melanie has a copy of the.
That's just a
form if you
figure of
want.
speech. It wasn't
I
meant to be taken literally.
Yeah, I know. I'm just gonna say,
Let's see.
Martha, I only had one copy, so you gotta pass it around.
I pass it on,
I believe it's there. I don't need to see it.
okay.
Divided A-frame with flashers, $20 a day.
Yep.
It's pretty clear.
Yeah, it is.
It's right there.
It's very clear.
Yeah.
That's not what my argument is.
Your argument is not, the argument is clear.
My argument is that
But you
I'm
didn't read
asking
it.
for a compromise because no one ever said anything to me. In the past, I've always returned my stuff to the city without any problems. It's been over a year. No one said anything to me about this new policy, so.
And then,
At $360 for a barricade, which I'm gonna have to absorb out of my pocket, because the owner's not gonna pay for that.
Right. So when you signed this, these amounts and things were on here,
Sure.
and you just signed the slot.
I didn't.
And
they
then the
didn't
rest was,
assign-
the
they
rest
didn't-
was filled in after you brought it back, is that what you're saying?
Well, yes, because of the number of days that I had it.
Right,
So you said, oh yeah, you owe $360 for
Yeah.
a barricade.
Should there be a maximum charge on the contract? I mean,
well, he left town to go to California
Right.
without thinking about this, and he kind of buried himself because of that, in complete innocence. I don't know. I think a maximum charge sounds like it might be reasonable, but that'd be after the fact.
but I'm saying, should there be a maximum charge on the contract to begin with? I mean, if somebody
Right.
has one for 2 months, are we gonna charge them $1,200 for one barricade or not?
Because you get one made for less than that.
Right, exactly, that's what I mean.
yeah.
I feel sympathetic.
I say, I'm
I would
prone to
accept the
be a human and
compromise.
say, we forgive part of it this time, but lesson learned, don't do it again.
We'll just,
The lesson was learned because I didn't come back to the city and borrow any more equipment, so.
I'll give like I treat my students, the first time I'll give them a pass. So I'll make the motion that we accept the compromise.
At half.
Half,
140, yeah.
so
Well, it's-
1/2 would be what?
One-
One,
Well, whatever you
180.
suggested,
180.
compromise was my
180.
motion. What was your motion, your suggestion?
His suggestion.
His was
my
the 7
suggestion was
days.
140.
That was
The
my
amount
motion.
of time that I used it.
Yeah,
My motion was to accept the compromise, which is 140.
I'll second your motion.
Okay, it's been moved and seconded to go to compromise with
We had to
140.
put a check next to his name for the future reference.
Any other discussion? If not, please call, oh,
Yeah, I told John, when I had done this before, when we started charging people, the reason we started charging people was, as John said, some of them didn't bring stuff back, some of them were broken, and we also want the contractor to have their own equipment. So I told John it was $20 a day. Now, maybe he didn't hear me.
Oh,
Because
no,
he
no,
was
no.
there.
My hearing is very good,
I'm
Darrell.
sorry, but I tell people it's gonna be $20 a day because that is something that's changed. But that's my word against his then, I guess, but I'm just telling you, I told him.
Yeah. When did you tell me, Darrell? Because you weren't there at the office when I went to pick it
When
up.
you called me and asked me.
No, I would have, I would have heard that, Darrell, sorry.
All I'm saying is, we want the contractors to have their own stuff. We know it's not cheap, but we want them to have their own stuff. Instead of coming to borrow our stuff.
Right, I understand that, I appreciate that. And after that, I didn't come back.
No, you didn't, and that's fine. But contractors should have their own stuff.
Yep,
That's our bottom line.
sure. And in the past, did I return things that were broken, or?
I've never had a problem with you, John.
Good.
Never had a problem.
Well,
Thank you.
I think the story that John has told us about how he left town tells us that he truly believed he did not know about this fee.
Well, I got a form here, John filled out in last year, where he's gonna rent 2 A-frames with flashers and 2 barricades with horses
Last year,
that you didn't do, so you've seen this form before.
last year?
It's got May of 19. Is that yours? You filled it out, but you didn't execute because you didn't want to pay the fees, my understanding.
No. What
So
do you
you-
mean I didn't execute it?
They were
Says
never,
John Wayne Call doesn't want to rent equipment. So that's May of,
last year.
doesn't want to rent equipment, borrowing from Bob Brown.
So you had to change your plans, it sounds like.
But he's seen the form before, is my point. Was aware.
Seen the form, but never rented, never had a charge before. That seems really strange. Where would that have been? That's the thing I don't, okay, well,
so we do have a motion
Call the question.
So, yes, so Rebecca, will you please call the roll?
Flournoy,
Yes.
Anderson,
Yes.
Hallie,
No.
Gandy,
No.
Ham,
No.
Toohill,
Yes.
Rasmussen.
No.
I think that was 4-3. No.
Fails.
Okay. Thank you, John. Next is Brian Hunger and Christine Estle. I asked Brian and Christine to come tonight, basically because most people know that we're having an uptick in the community and elsewhere around Iowa. We're not the only state. So I thought we should hear another update from Chris and Brian. So go ahead, Chris.
You ready? Okay. Hi, I'm Chris Estle. I'm the Public Health Administrator for Jefferson County. It's been a little bit since I've been here. The guidance that I'm going to tell you hasn't changed any, though. I'm going to remain the same. Wear your mask, social distance, wash your hands, stay home if you're sick. That guidance has remained consistent. Try to avoid large gatherings. This is in my press release for tomorrow. I'm going to say that we've seen an uptick in numbers partially because of gatherings, social gatherings, and it doesn't matter what size the social gathering is. So think about that the next time you're hanging out with your friends, family, or wherever you may be going. So today, as of 2 o'clock, I always preface it with that. I have it on my phone here. We are at a total of 361 positive cases, and of that, 190 of those are active cases. What that means is the Iowa Department of Public Health has outlined 28 days as the day where those cases drop off or they're considered recovered. Now, obviously, not everyone is recovered in 28 days, but historically, that's what we've seen thus far. So of those 190 active cases, 44% are in the age group of 18 to 40, and 28% are in the 41 to 60, and 53% of those individuals are symptomatic with one or more symptom of the coronavirus. So I'm telling you, as we move throughout this influenza season and the winter illness, it's going to be very, very difficult. And I can't stress enough, people call the health department, want a mask mandate, want us to fix it, want us to make it better, want us to make it go away. Well, it's not a political response, it's a pandemic response. We're doing everything we can, but everybody else has to do everything they can too to help mitigate the spread. We've been very fortunate. We've had only one death. Still, one death is a lot because we're a small community and we know those individuals that have been sick, or we know the person that has passed away. So I don't have any magic words to make it better. We're in it for the long haul. Your health department staff is very tired. There's only 6 of us that work in that health department, and we're on the phone from the time we get there till the time we leave. And then I take calls after hours on weekends and whenever else somebody deems it necessary for me to know something. So we participate with our community partners in the Iowa Department of Public Health every Tuesday from noon to 1 or 1:30 for a state update. I share that information with our partners. I think that's important so all of us can get on the same page. I invite our hospital partners, nursing home, assisted living, dialysis, our school nurses. And when I'm talking school nurses, I'm talking Fairfield, MSAE, and Pekin. Sometimes people forget that Pekin is actually in Jefferson County, and it is. So anyway, if you guys have any questions or comments, or I'm not going to ask you if you have any complaints. Questions or comments, complaints are not here. So you have to keep a sense of humor or none of us will get through it. So
Chris, how's the response with contact tracing?
Contact tracing
Are
is
people
rough.
being responsive?
No, and they're lying. At the end of the day, this is a virus, and there's nothing that we're going to do for people that are positive. Like, unlike pertussis, which is whooping cough, there's something that we can do for people if you've been exposed. We can put you on an antibiotic, and then, that prophylaxis helps keep you from getting sick. With this coronavirus, there's nothing that we're doing for people other than telling them to stay home for 10 or 14 days, depending on if they're in isolation or quarantine. That makes a lot of people angry. People can't afford that. People don't believe it. People say all sorts of colorful things to us. So contact tracing is really not effective when you have this amount of numbers of illness. It's a huge waste of time because there's nothing that we're doing. I have voiced that to the Iowa Department of Public Health interim director. I've voiced that to my state epidemiologist. I've voiced that to my regional epidemiologist. Why are we collecting data when there's nothing that we're doing for the greater good of the public? If you can tell me why we're doing it, I will do it. But there's nothing that we're gaining by doing contact tracing. If
But if-
you're sick, go to the hospital if you need higher level of care.
But if people were being responsive and not being afraid to call you back, you don't think that
No.
would help,
No, because there's nothing that we can't give them a pill
right?
to prophylax them. We can't, what we need for them to do is stay home for 10 or 14 days. And they don't, or they can't. There's a
I guess
lot
that
more-
was that's my point, that,
It's all about human behavior.
yeah, that they
And-
need to do that.
Yeah. It's not public health's responsibility to do that. It's every individual's responsibility to do that. We don't see chickenpox anymore because there's a vaccine for that. But if you go back a generation, my kids had chickenpox. They're in their early 30s. So incubation on chickenpox is 21 days. So every 21 days or every 14 days, some kid in second grade is breaking out, running a fever. You're contagious before you break out in pox. So teachers we're used to that. We're not a society of waiting. We're not a society of being isolated or quarantined. And that's what it's all about. I mean, it truly is. That's what it's all about.
And when we've had some of those, like you say, chicken pox or whatever.
Mumps.
Yeah, when we were all little.
Right.
Would you say that it's different in the sense that, I don't think we were mandating masks or anything at that time, correct? Or when polio was going
was
on?
only
Was
like
there a
2
time
then.
where we
No.
ever, as a, public, did that? I'm just curious.
I'm sure that there was. I mean, we're such a migrant society now compared to when I was a kid in the late 60s and 70s. I mean, people didn't do international travel. People weren't as migrant as they are now. Most people had a mom that was at home, or most families had a mom that was at home, or a grandma that could help. Now everybody's working 2 or 3 jobs just to get by. The whole family definition is different, and that's not for me to discuss tonight, but
Yeah.
there's a reason people can't stay home. And they have to go to work. We're going to learn a lot more about this virus. We just don't know everything about it today. We've learned a lot in the last year. If you think back to last November, we were talking about Wuhan, China, and this new virus, and we were watching it unfold on the TV. I looked at my notes. I had my first meeting last year in December with community partners talking about this new virus. Before it was ever named COVID-19, that's when it was still the coronavirus. It's been a long year. It's not over.
And is there any movement from the state to mandate masks?
It's too late. It would not matter if the governor did it today or tomorrow. It's too late. It's already here. It's already got a hold in all of our communities and long-term care facilities. It's just a matter of time before it happens in our community. It's just a matter of time. It's unrealistic to think that it's not going to happen. The goal was never to keep people from getting sick. The goal was to keep people from being sick at the same time and putting that stress and pressure on our healthcare systems.
So the strategy still is to flatten the curve, if you will?
Yeah, exactly.
So what,
Exactly.
how many new cases per day are we seeing?
It depends. Like today, we had 34 new cases, but that got dumped into our queue over the weekend.
So do you know where we are on the curve? Is it front, half, top, or do you know?
Honestly, I am not a numbers person. I'll tell you why. Because for every number that's positive, I'm sure that there's probably 2 people out in the community that haven't been tested, or they're symptomatic or they're asymptomatic and they're positive and they either don't want to get a test or they're asymptomatic and they don't know that they're sick. So I don't just focus on numbers. I focus on what my hospital partners are telling me. I focus on what we're seeing in the news with hospital surge, and Brian will speak to that here in a minute. So, and remember, a test is just a point in time. I could get tested today, it could be negative, and by Friday I could be symptomatic or I could be positive on Wednesday. 14-day incubation is what they think with this virus. Everybody sheds a virus differently. A virus impacts all of our bodies differently. Doug could I'm giving you the 2-second nurse version. Doug could fill us all in on that, but It's been a rough year.
Yeah.
We have great community partners, our hospital, our emergency management coordinator, our long-term care facilities, assisted living, our dialysis center. We had a tabletop exercise in September, and people participated. We were planning for our points of dispensing when the vaccine becomes available. Huge storage issue with that because that vaccine's got to be kept at like 90 degrees below zero. I don't have storage for that. We're figuring all that out as it comes. So lots of stuff that people just get angry about and think that we can just, snap our fingers and fix it. Yeah.
You probably talked to other public health officials around the state.
Oh, yeah.
Are they having the same problem with the contact tracing that
Yes.
you're having here?
Yes. And all of us that are nurses, that are the public health administrator, feel the same way I do. You have to read the Des Moines Register sometime later this week. I totally believe in contact tracing, not for this illness, I do not. Because we're not doing anything for people. There's not a prophylaxis mechanism for them. It's creating a lot of work, it's creating a lot of jobs at the state level. The state's hired 90 to 95 people to do contact tracing. About half of the county health departments are no longer doing contact tracing because they don't have the infrastructure to do it.
Interesting.
Yeah,
Thank you.
yes.
Well, and again, one of my concerns was to also hear from Brian about, in the spring, it was all about not overwhelming our healthcare system and wondering how we are now. If you go on, the state website, you will find how we are doing in our region with number of beds and ICU beds, et cetera. But again, I wanted to hear from our local people, so our community could hear locally what's happening. Thanks, Brian. Go ahead.
Oh, well, thanks for having me. I appreciate being able to get out and talk about the hospital and what the great things that our staff and professionals are doing for the community, because they are fabulous, and I always enjoy getting out and talking about them. As far as just some updates and things that we've talked about in the past, as far as update-wise, we've talked about safety measures in the past. There's really no changes at this point. We still have visitor restrictions, still requiring masks. So that's the same. We've talked in the past about PPE shortages, and as to today, we really don't have any concerns about a shortage of the gloves and masks and gowns and those type of things. Our supply chain's been able to open up a little bit, and really we're working on building up the inventory at this point. The just-in-time mentality works for just about everything except for PPE equipment when you really need it. So we're building up our store on those items. As far as COVID cases, the reality is that nationally the number of cases are increasing. For the state of Iowa as a whole, the number of cases are increasing. The slight difference in the state of Iowa is the rate of increase is the positivity rate in the state of Iowa is a little bit higher than nationally. As far as Jefferson County Health Center, we've also seen a number increase of cases. I can give you an example. The third week of September, we tested 70 patients. We had a positivity rate of 1.43%. Obviously very low. Last week, we tested 274 patients, and our positivity rate was 20.07. And every week in between then, it just increased a little bit every week until we got to 20.07%. So we are seeing that increase. Part of one thing that we've really worked on from the beginning is our ability to test patients. And we have been able to do that. As you can see, just the sheer number of tests that we performed. Our test kits have been opened up. We've had more ability to do that, which we're really happy to do. But as an overall update, though, we've also, not just COVID patients, but we've seen an increase in illnesses in our healthcare facility. We have generally 14 to 15 patients in our med-surg unit, in our inpatient unit, on average. And I'd say the past 4 months, we've been running right around 20 to 21 patients, which is significantly higher for us. Our max is 25. And so it's been interesting to see that, yes, there's an impact from COVID, but we generally have 1 to 3 COVID-related patients in our hospital at a time, in our unit. So there's other illnesses that are going on where we're seeing patients who are sicker than what they have been in the past, and there's more of them. And so we're also dealing with that. We continue to work in southeast Iowa with other hospitals, basically from Cedar Rapids south and over to the river. We have weekly phone calls with them on multiple levels. I know I have a weekly call. And then we also have nursing recon calls and talking about bed capabilities and staffing challenges that are going on. And I think that is one of the biggest challenges that the region's having, and we're seeing it too, is just the staffing and the burnout that it's had on our staff and having to deal with it. I mean, I'll venture to say that I'm tired of COVID. I'd venture to say that everyone here is tired of it, COVID too. And then you take a group of people who every day they come to work, go through the very same thing dealing with this. And they're really tired. I mean, it's burned out. And we're really trying to put a lot of effort into being supportive for our staff so they can continue to do a fabulous job. They've worked through it. They do a great job. No concerns there, but we keep trying to work to make things a little lighter and a little easier for them. And I really can't say enough about them, and couldn't be prouder of what they do for us. The things that we're looking forward to is obviously there's continue to be work on COVID vaccine. I know Pfizer had an announcement today, I think, that came out, and so I think there's getting closer to a vaccine coming out. I don't have any details really of how it's going to be distributed, how many, who's going to be priority lists, so on and so forth. But I would say that we're getting closer. Other than that, I'd continue to encourage people to wear a mask when you're around others. Wash your hands regularly, social distance when possible, and stay at home when you're sick. And I'm happy to take any questions.
I guess again, I have been encouraging people to wear masks when you're out in public.
Yeah.
I'm getting 1 or 2 requests per week to mandate a mask. And at this point, it's been the same message that we've been told that we can't legally.
Sure.
John, do you have anything new on the legal side regarding that? And has
I don't
any,
think the governor's gonna change their position, and that's where we're stuck with.
and if you wouldn't, John, if you come to the microphone, has there been any challenges of any of the other cities that have mandated a mask?
There
To your
has
knowledge.
not been. I'm watching it through the Municipal Attorneys Association. And, I mean, there's the potential probably for about 10 challenges. Most of the metro areas would prefer a mandate, but they're not going to do it. The governor's been trying to kind of skirt the question by encouraging the use of masks. And I don't think anybody's comfortable that the Supreme Court's going to go over the governor. And so there isn't anything right now. Some of the other states that have had mask mandates, they've had what I would call compromises of stalemates. Texas, cities like Houston and Austin, they challenged it in the Supreme Court, but then the governor stepped back and said, I'm going to let cities do what they want to do. So there is some precedent happening other places, but I don't think our administration here in the state of Iowa is using that as a key for what they want to do. But
So, John, is there any city, despite what the governor's ruling is there any city in Iowa that is mandating wearing masks?
they've passed ordinances.
What city? What cities do you know?
Waterloo has a mask mandate ordinance, but they're
Iowa City.
not enforcing it.
That was my next question. Does anybody have a fine or any kind of enforcement?
That's the problem. It's, as the governor says, it's hard to enforce. And so I would expect you'll see other towns that take up that, especially as the numbers keep getting worse, why wouldn't they?
I know Dubuque has, I believe Dubuque also has one.
What's interesting is my girlfriend and I went to Vegas this summer, and it's hard to enforce in public, but all the casinos require them because that's private property. So any business is allowed to require masks, and I don't know if that's, some people think that they're allowed to take it off because they say my rights are being infringed on, but that's private property, and that business owner is allowed to mandate masks for that interior space on their property.
That's absolutely right, Mike. And any business in this town has the right to have its own rules as far as the conditions on which it serves customers. And mask is just one of the possibilities.
And I think
Right,
that's,
but they're not, also not enforcing, like at Walmart, they're not enforcing the rule. They have the rule, but they don't enforce it, so.
I think that's been also my position, is to let the businesses do that, because that's where people are more together, you know, gathering. I mean, yes, we're gathering, apparently families, I think that's been happening. So, again, this is my perspective, that I have mandating a mask, without some kind of fine or without an enforcement, it just seems like it's empty words. But ultimately, I want to hear from the council how they feel about it. What's your opinion?
Well, if we don't have authority, I don't think we should be passing ordinances that we don't have authority to operate, in an area that we don't have authority to operate in.
Should the city be setting an example? If we believe it's important to wear masks, should the city be setting an example among its employees? I mean, I believe we have within the city staff and employees, we could require masks. Is that right? Would that be right, John?
I think so.
Right.
We do have that authority.
So while there's a question as whether or not the city can mandate it for every citizen or everyone who lives within the city or who's in the city, if we deem it important, we could mandate the city, all employees, to wear masks.
Currently, we already have our water, sewer, streets, and park and rec. If they are out in public working with other people or working together within 6 feet, they have masks that we've given them to wear and should be wearing. So we, to an extent, have already done that.
But we could, I'm saying we should, but I think we could probably mandate masks even further among city employees, for example, here, City Hall, or other places where city employees are gathered.
Correct.
Right?
Then we get into that place with the HIPAA stuff, there are people who cannot wear masks because of health reasons, and then that has to be exposed. So what are you going to do with that?
Well, you can have people wear shields instead of masks. That's what I do at work.
According to the CDC, though, just a shield is not considered.
Come closer, please.
According to the CDC, though, a shield is not considered a mask. It's not considered the same level of protection. If you look at the CDC guidance, it's not the same, so.
What's the guidance on the plastic sneeze guard that we have out front
That you
here?
have out front?
Yeah, is that effective at all?
Well, it's better than getting coughed on.
So it's just.
It's better than getting coughed on.
Yep.
But the thing with the shield is it can come up underneath where your mask should be snug fitting. This one's got a little gap right here, but it's snug on this underneath and on my nose.
Keeps your droplets to yourself.
Trying to keep my cooties to myself. Yeah, because y'all don't want them, I'm sure, But I'm just looking around the room and I'm just thinking, again, I asked Assistant County Attorney Pat McAvan about mask mandate because we have a Board of Health meeting coming up, and the enforcement component of that lies with the governor. So I don't have time to run around and be the mask police. Don't have time for that. If you want to wear a mask, wear a mask. If you don't want to wear a mask, I'm not going to make you. I don't have time to mitigate human behavior to that level. That might sound cold and callous, but it's a fact. I think our law enforcement have other things to do as well. At this point, it's too late. It is too late. 14 days from now, you heard what my numbers were. 14 days from now, how many cases do you think we're gonna have? Take just a guess. I think we should do a poll on that. You guys at your homework, because in 14 days, we're gonna continue to see a spike. I'm not being flippant. The reality of it is nobody wants to hear the reality. And it's here, it's community spread, and it's difficult even when you're doing contact tracing to make sure, you can't always pinpoint it. If you go to Casey's, Hy-Vee, Walmart, TSC, and Park and Rec all in one day, do you know every person that you had contact with? No, you don't.
Do you have an estimate?
Do I have a guesstimate? I think we're gonna see 600 cases.
600 active cases?
I think will be the total, will be over 600 easy. Now, I could be wrong. I'll be happy if I'm wrong. I'm not a stats person, but think about where we're at today and in another 14 days. If we get into one of our nursing homes, long-term care facilities, like we've seen in lots of other communities, there's not anything you can do about it. And our long-term care partners are wonderful. It's not a lack of trying. I said this to our school board and to our school, or to Dr. Knoll at Fairfield. I said, we cannot hold schools and workplaces to a higher level of accountability than we're holding our own selves to. I can't send my kid to school and expect the school to keep my kids safe when I'm not doing everything I can do to keep my own kids safe.
Sorry, getting a tickle in my throat just
Are you
thinking
sure
about
that's
all
what
this.
it is? It all starts with a, no. But I don't have anything else unless you guys do. I'm not getting on my soapbox,
I am
but
gonna go get some
everybody
more.
can make a difference.
Yeah.
Can I do that?
Yes.
We're not through it yet. Wait till we have influenza, RSV, pertussis, chronic lung conditions.
Well, to
You know.
Paul's point, is there a benefit to having our city employees who are interacting with the public behind the plastic shield also wearing masks? Is that going to contain something?
What about in this room right here, right now?
Well, that's a question. What about this room right now?
I'm wearing a mask.
Right? Now, we're understanding it's socially distanced.
I don't think you're 6 feet apart.
So your recommendation would be,
The same mitigation practices that I've said since March. Wear a mask, 6 feet, social distance, wash your hands, stay home if you're sick. Same issue. We can't expect other people to follow the rules when we exempt ourselves from the rules or the guidance, the science-based guidance.
Chris, would you say that there's really nothing,
Excuse me,
one
Brian.
thing that's going to keep it
Oh,
from spreading?
no.
Brian,
That's
come
why
up.
we do-
Come up closer, Brian, please.
Far away from the mic, sorry.
I was just going with Chris' point, there's really not one thing that's going to keep it from spreading, right? That's why we have multiple things, and each piece isn't gonna keep it out from spreading forever, but it will help reduce the risk of spread a little bit. And so that's why we say have a combination of things that we keep working on, so.
Eventually, we'll all get it. Eventually, we will be exposed and develop antibodies. We will, and not be sick from it. We'll be sick from it and develop antibodies, or we'll get a vaccine and hopefully develop antibodies. Sometimes people don't develop antibodies from a vaccine. That's proven. I'm not the science teacher, but I'm just a nurse.
Well-
Did I guilt you into it?
you've shamed a couple of us.
No shame, I'm just making a point. This is how it's spread so easily. Spread so easily. I don't have anything else, but thank you for
Yeah.
having me.
Well, and let's just point out that one of the reasons we haven't worn masks here is because we're social distancing, and when you wear a mask, it's pretty muffled.
I
So
get that.
we wanted, to be clear out there to the people who are watching the council meetings.
I get that, but
Yeah.
I get that. But again, we wonder why we have increased numbers. This is part of the reason why. So, thank you.
Food for thought. If the numbers do what are projected and it becomes a situation where you see metros starting to do mask ordinances that are actually in court, we can do an ordinance quicker than what you're used to doing. We can do an ordinance in one reading. You can do an ordinance on an emergency basis. You have the same police power authority that the state has only at the local level. Basically, the governor under the Constitution and the legislature, their policing authority as far as public health, it's just parallel to what we can do here locally also. So a mask ordinance isn't out of the question. It's a question of, do you want to run into headbutting with the governor versus home rule challenge? I think there's a very strong argument that any of the cities can make that we do have inherent home rule authority with this parallel police power to do it, but then we're back to where we were talking a little bit ago. You still got to enforce it, and whether we're going to be the mask police or whether the state's going to be the mask police, or whether you have National Guard circulating neighborhoods on bullhorns talking about, please do what we're asking you to do. We're not there yet, but the police power and the way that you control something that's a public health issue, it's been out there the whole time we've had a state constitution. So that's what it would come down to, in my opinion, and I've researched it, and the Municipal Attorneys Association is watching this thing every day. So, you know, if there's going to be something like that, we could, you know, maybe we should talk about it more at our work session this Saturday as far as something else that will continue to be on the table for us and it's probably going to get worse.
Okay, thank you.
Okay.
I think we'll add that to the agenda on Saturday then. Okay, thanks, Brian. Thanks, Chris. And by the way, I haven't been sick at all. I just got this little tickle in my throat. It was weird. Okay, let's go on to resolutions, action items, and ordinances. The first action item is consideration of the fiscal year 20 annual finance report. And you do have that in the packet. Rebecca, do you want to, or Aaron? Want to discuss?
Just, basically, it's where we ended up at the end of the fiscal year. Some of the notables are, things didn't, some of the revenues didn't come out the way we expected, but they grew in others just because they were receipted differently than what we expected to when we budgeted for it. Some of the expenditures, we went over a little bit in culture and recreation than what we budgeted. There was the library boiler that we spent money on that had not been budgeted for. There was a drop in what we budgeted for, partial payment for the lighting. The project hasn't been accepted completely yet, so they have not been paid in full. Some extra money was left in general government for contingency money that we budget for all the time and we don't spend, which is a good thing. Capital projects came in a little lower. I think that was due to the delay of Monroe reconstruction, because we held off on that because we didn't know where funds were going to be available or not. So all in all.
Any questions? We need a motion to approve this, correct?
Yes, please.
Okay. So is there a motion?
So moved.
Moved by Anderson,
Second.
second by Gandy. Any other questions? Not, please call the roll.
Anderson?
Yes.
Gandy?
Yes.
Ham?
Yes.
Hallie?
Yes.
Flournoy?
Yes.
Rasmussen?
Yes.
Toohill?
Yes.
Okay, thank you, that was passed. The next two resolutions are regarding this real estate where we are vacating easements. The first one happens to be for the Robert Byrnes and Jennifer Byrnes property, and the second one is for Chris Simons and Carrie Wheeler Simons. I'll take a motion to approve those. Well, we should do one at a time here. For the Byrnes property,
Motion to approve?
Second.
okay, moved by Gandy, second by Flournoy. Any discussion? Not, please call the roll.
Gandy?
Yes.
Flournoy?
Yes.
Toohill?
Yes.
Rasmussen?
Yes.
Anderson?
Yes.
Hallie?
Yes.
Ham?
Yes.
Motion carried unanimously. Okay, now we go to the Simons property.
Motion to approve resolution?
Second.
Moved by Gandy, second by Flournoy. Any other discussion? Not, please call the roll.
Gandy,
Yes.
Flournoy,
Yes.
Anderson.
Yes.
Ham,
Yes.
Toohill.
Yes.
Hallie,
Yes.
Rasmussen.
Yes.
Okay, next resolution, consideration of authorization to submit an application to the Iowa Department of Agriculture and Land Stewardship Water Quality Initiative Urban Conservation Project for funding assistance. This has to do with North Campus Village. I see Martin's here. Do you want to give us the rundown quick?
Hi, yes, it's a great opportunity. We had contacted a company about helping us design some interesting stormwater features. And they came back and said, actually, there's money available to do this, and if you would like to file a pre-application just to get on the list for this government agency, we can work it out later and get the plans all in, but there's a deadline coming up where you, in the packet I gave you, you just come up with the briefest outline of what you're thinking and let them know where you are, who you're going to partner with and all that. And then you're in kind of a finalist, and then it's really worth coming up with a detailed plan. And they will pay up to, they'll reimburse up to 50% of the project, up to $100,000. So you can have a $200,000 project, which is well above what we were planning, but there's interesting things that they can do, including even possibly help us with our street budgets, with things like concrete that is permeable, and you have water collectors underneath it and things like that that we may be dreaming in terms of getting that in under $200,000, but it's a lot more money than we had budgeted. So we'd like to give it a try. We can't apply directly. Fairfield is the applicant and that partners with us, and with the understanding in the application even, that Vastu Partners would pay for everything and do all the work. And so there'd be no liability on to Fairfield for paying for it or overseeing the work.
You just need a resolution.
Yeah, just a simple resolution to put in
Supporting your application.
the pre-application. And then when we do a real application, then we would sit down with Melanie and see if it really makes sense for the city's goals too.
So you're directing the city administrator to sign off on this resolution in support of this.
Correct.
Motion to approve.
Second.
Moved by Anderson, second by Flournoy. Any other questions or discussion? Not, please call the roll, Rebecca.
Anderson,
Yes.
Flournoy,
Yes.
Rasmussen,
Yes.
Ham,
Yes.
Gandy,
Yes.
Toohill,
Yes.
Hallie,
Yes.
Okay, that was approved unanimously. Thank you. Thanks, Martin, for coming.
Yeah, thank you.
The next, we're going to open a public hearing in just a sec here on the matter of proposed North Campus Village. This is Phase 6, Urban Renewal Plan for a proposed urban renewal area in the city of Fairfield. So first, I believe there have been no written objections, correct, Aaron?
Correct.
Okay. And do we have anybody here or anybody else want to make comment? Nope. So well, I guess I should have said, we'll open the public hearing for anybody that wants to comment. But now there's nobody, so we'll close the public hearing. Okay, thank you. So now we go to the resolution to approve the urban renewal plan. So this is consideration of resolution determining an area of the city to be an economic development area. So this is the resolution that supports that.
Motion to,
Before we make the motion, I just wanted to say the Planning and Zoning Committee approved the area as generally, I forget what's the word, conforming with the comprehensive plan of the city. So the planning and zoning has approved it that far, so now the city may move forward with approving the resolution for the area.
Motion to approve resolution as set forth in the agenda.
Second.
Second, okay.
Okay, moved by Gandy, second by Flournoy. Any other discussion? Not, please call the roll.
Gandy.
Yes.
Flournoy.
Yes.
Ham.
Yes.
Hallie.
Yes.
Anderson.
Yes.
Toohill.
Yes.
Rasmussen.
Yes.
Okay, that was approved unanimously. Now we go to the ordinance, providing that general property tax is levied and collected each year on all property located within the North Campus Village Phase 6 Urban Renewal Area.
Move we approve.
Second.
Moved by Flournoy, second by Rasmussen. Any other discussion or questions? If not, please call the roll.
Flournoy.
Yes.
Rasmussen.
Yes.
Anderson.
Yes.
Gandy.
Yes.
Ham.
Yes.
Toohill.
Yes.
Hallie.
Yes.
Thank you. That was approved unanimously. Okay, under the mayor's report, I just wanted to report that Friday, Paul and I had a tour of the wastewater treatment plant, and we had a good time, didn't we, Paul?
Yeah, it's a great time. It's a good place, I would just suggest, it's a good place to begin the experience of wearing a mask, just to keep that in mind.
Yeah.
They do a heck of a job out there. We're
Yeah.
very grateful.
Let's just say Paul and I have really a great new appreciation for our employees out there. They're doing a thankless job, but they're doing a great job. And actually, it's really fascinating to see the new equipment happening and working. And we hope that, well, actually, we talked about getting with Jason and going out again and showing the public, getting a little video going and explanation from Sean, so people understand what really what they're paying for in their sewer bill. So because it is a big operation. So thank Sean and the wastewater department for all their hard work out there. Want to remind people that on Wednesday, November 11th, is Veterans Day. It's the day in which we honor our veterans that are still here for their service to our country. And I hope that everyone, I'm not sure, I haven't seen any kind of program, so I'm assuming there's not going to be one this year.
Flags will be up on Central.
Flags will be
I
up.
think there's a virtual one at the high school.
Virtual
I see
one.
they were doing it
Okay,
virtual.
great. So is that at 10? Do you know?
That I don't know. I don't
Yeah.
remember the time.
Anyway, hopefully, take a moment out of your own day to thank our veterans and their service. And that's all I'll say. So, city attorney report. Do we have anything, John?
Just want to mention.
You want to go to the mic,
I
please?
will. Aaron, did you get a confirmation from the Board of Supervisors about the next meeting?
I sent them
Joint meeting?
I sent them an email today regarding having a joint meeting for the next meeting for the city council on the second meeting, so I have not heard back from them.
Okay, assuming that they decide they can come to our meeting, we may have to configure ourselves a little bit next meeting, and probably allow 20 minutes to a half hour at least to discuss this thing about communication and dispatch and how we're handling expense and how we've been handling it for the last 20 years. So it'll be something else that maybe Aaron and I will mention a little bit to you about at the workshop on Saturday also. Other than that, we're continuing to work towards the settlement of the AML Service Agency situation, and I'm pretty optimistic. So other than that, nothing new. Okay?
And I would suggest we wear masks at that meeting because we'll have more people in here. Okay, committee and board reports. Property committee?
Property met this evening at 6 o'clock, and I think we had a very good meeting that we discussed at length the Natty land and working with the committee, the current committee that has been very involved with it. And I think that there was good understanding about how and what needed to be done to be sure that we all stayed within the realm of the fact of it being, as I say, basically, it's money that comes from the government, and we wanted to be sure that when we are audited, there's no doubt about it. So we did discuss with Ron Blair and the committee tonight the need for a budget, which they understand, and it will be presented to the foundation, and then we will be able to move forward. So I think, as I say, it was a very good meeting. Everyone seemed, I think, be satisfied with the decision made. And then we also looked at, in the sale of a city property, Melanie gave us a presentation on 2 pieces of property on Jefferson Street that are small, that I guess do belong to the city. But there is the possibility of determining, we feel that definitely that we should move forward, that someone is interested in building 2 small houses, 2 small homes. So, in other words, that we're sort of turning back to Melanie and determining whether it, needs to be surveyed and all the things that go with the possibility. But we agreed that it would be certainly a credit to the city if they could be developed. So those are the development. Then we discussed Lamson Woods, and Michael gave us a good presentation in terms of what his thoughts were and the Arbor Committee regarding Lamson Woods. And he sort of admitted that they have some more research to do before we can kind of move forward on some of the Lamson Woods management plan and projects. But as I say, we definitely did discuss the need for doing something with it. So I think, again, that's going to be an ongoing project, but worked out very well. So that sort of covered property.
Great, thank you.
Are there any questions?
Well, a couple things to note also. Martha did a great job of summarizing what we recommended to Ron as far as changes to the bylaws of the Natty Committee. The one thing that Ron does want to do, and I feel would be an okay change to what we recommended to him for bylaws, is to that he wants to make sure that he presents to the city council and the Park and Rec Foundation a budget each year. So I said, that's fine. We could do that. That's not a problem. But other than that, the bylaws, as Martha had said, the bylaws recommendations would that they'd report to the Fairfield Park and Rec Department and the foundation. The other part of note is that the CPR monies would only be spent in the city or on city property, not in the county. So those were the notes from the bylaws that we made recommendations back to Ron for change.
Does that money come into the city coffers?
It actually goes to the Park and Rec Foundation. It doesn't come to the city. But it's city property. The Rec Foundation takes the money in. So as city dollars, that should be at least, but should benefit city property.
So if you remember when he came, what he was looking forward to was that the committee also would take over other prairie remnants, the
Wetland
Eastman
areas.
wetlands and the Neff wetlands. So the Neff wetlands is not in city. So that would be excluded.
Because that really is the way it is provided, that it will be used on city property.
So is there any recommendation made to the council from this meeting, or no?
There really isn't at this point, I don't think.
I think we should
mean,
bring these bylaws back to county, or to council to vote, because the committee hasn't reviewed them, but Ron has, and he says, this is what it's going to be, let's just get it formalized, but not everyone's seen them, so maybe next meeting.
I think one of the biggest things was making the committee understand the need for working with the foundation, and that they are an entity unto themselves, and I mean, I think they've done a great job, but I think it was really important that we clear the water to be sure that everyone understands that, you know, they can't just totally be an entity of themselves, that they need to really understand the need for their budget to be presented, and then money, when it is, goes into the foundation, and then they're entitled to, pursue their work. So, but there's really nothing to hardly recommend at this point, I don't think.
And I
to
think
the
that's
council.
what they've always felt. It's just that we're now formalizing it in bylaws.
Right.
And, that committee, the council is actually putting a stamp of approval on everything now.
Right.
I think years ago when the committee was formed, my understanding, when the committee was formed under Park and Rec, it was never formally brought to city council. And so city council apparently didn't formalize it. So we've been working on this process for a while and working out the details. And so I think that's a good idea that, next meeting, you see the finalized proposal for those bylaws.
So the money's generated from CRP
Yes,
land?
Yes.
And that land is owned by the city?
yes.
So really, it's city money.
It was
Right.
given.
But you gotta
Yeah.
read you gotta
Well,
read the agreement.
The CRP is actually because it's farm,
It's it's agricultural land.
farmed, the contract is with the farmer
Yeah.
and Park and Rec or the foundation as the second.
Yeah, so the
on the
farmer is the
contract.
tenant, and he
So,
turns it
yes.
over to the
So he
foundation.
turns that money into the foundation.
And that's just the way it was written for some reason. So if we're not gonna change that,
So we don't own the land,
we do.
We
We
do
do own
own
the
the
land.
property, yes.
but we're farming it out to
Larry Dyers.
whoever's.
Yeah.
Yeah.
Well, and he has signed a 10-year contract in terms of,
Correct.
the CRP money. So it's going to be something that will be
Right, I was just
continuing.
curious about oversight and
Right.
auditing and that kind of thing, because if it's city money, we should be watching it like
And that-
any other pot of money that we
Right,
have.
well, even, then that's why we're trying to formalize this a little bit more, so that there's a actual budget presented. Any invoices are submitted and approved, they're not,
I was gonna say, could we make that
Right.
part of a line item in the city budget, so it passes through our regular,
it's not, doesn't come into the city, so no. But it goes to the Park and Rec Foundation, which is again audited as part of the city.
So you could see that. We could request that.
Right.
just,
Yeah. And it's
just so it doesn't
always,
disappear again and then,
yeah,
nobody
no,
knows
and
what's
it's always
going
been going through there
on, right?
and the bill's submitted there. So, you could go back and review things.
But I did pick up on that, that's what the committee is concerned about, that if that money goes through Park and Rec, that somehow it would get dispersed
Diverted.
somewhere
I understand.
else.
Yeah, I understand that.
But the understanding was the CRP is actually supporting what they're doing, and so it will continue to be theirs to use.
Well, and I think that, sometimes there were problems when a bill was presented technically to Park and Rec Foundation, but nobody really knew
Where it was
almost-
supposed to go.
I don't mean to say they knew where it came from, but they didn't really know why, and they had no anticipation in terms of how much they were going to be spending or for
Right.
what and things. So I think it was clarified.
Yeah.
Yes,
And I think
yes.
over the years, there's been turnover of employees and board members, and so things kind of got lost in translation without a more
Essentially,
formal
it's kind of a
process.
committee
and-
that kind
and
of can
bylaws.
change. I mean, and that's the reason I think that it's important that it get everybody understands that it goes into the foundation.
Yeah. Great. Okay. So we'll bring those bylaws back the next round.
Right.
Yeah, I'll work with Ron, and we'll get them
Okay.
finalized so that the council can approve them at the next council meeting.
Okay.
I guess I would add that this would be one of the things we would want to add onto our annual review, so we can be reminded
Oh, yes.
every year that this contract exists as a 10-year limit. It's being handled by Park and Rec Foundation.
Yeah, good idea. Add that to that Excel
And-
spreadsheet.
Well, I guess we have to have that committee work the 10-year harvest plan then too, right? Before we would put it on the list, is what I'm saying.
Oh, the Lamson Wood Management Plan?
Right.
Yeah, it's not specific. It's not going to be in their bylaws. It's something they can have input on, which they will,
Okay.
but yeah, it's not something we have to formalize because it's It's just one of the plans that they want to be part of.
Okay,
'Cause they want to do management plans for a lot of areas that the city owns.
okay.
Great. Anything else on property? If not, let's go to, well, do we need to go to, you want to talk about planning and zoning?
Well, the,
Talk about that.
are you gonna talk about it? Go ahead.
Public meeting.
Yeah, normally we wouldn't report on planning and zoning every meeting that we have, but with the mixed-use stuff that's going on, we wanted to give the council an update. A week ago, planning and zoning met at the old Harbor Brush building, which now Breadtopia, to get public input on the mixed-use zone. A lot of really good input was given, a wide variety of both people who live in the proposed mixed-use area, as well as some industries that would be adjacent to it. So, again, lots of good input. The next step for the Planning and Zoning Commission will be to have a meeting on January 4th, where they will fine-tune the ordinance. They'll probably have another meeting in February, so we wouldn't be expecting a formal zoning change coming to council till March or April. So the committee, maybe it's not going quite as fast as we had originally hoped, but we're getting a lot of really good input, which is just as good, so. And Michael and Aaron and Connie were all present, if there's anything to add.
I just want the council to know that while there are some people who have property in the proposed zone who do have some questions, because currently, if it's zoned B2, there are certain allowable uses. And this mixed use limits that somewhat, but it also allows other uses that they don't have. So they'll lose a little, gain a little. And Melanie has a call with the Allers lawyer to make sure we handle our code properly, because if somebody says, well, I don't want this change, and we change it anyway, and we take away a use, do they have any legal right? And so, again, we're trying to make it clear, the ultimate goal is to allow more uses, even though some that would be business or industrial uses that are incompatible with housing can't be allowed because we're adding housing. So it's kind of a seesaw effect, and we're working through it. I do want to say that some property owners kind of southeast of the current zone were concerned we'd move into that area, and we absolutely will not and cannot unless we were to change our land use, future land use plan, because that is a completely different zone than the area we're in. We're in a zone, the mixed use is in a zone called the entrepreneurial zone, or entrepreneurial district, and to the west and the south is a industrial district. So we can't by law rezone that in a way that differs from our future land use plan unless we change our future land use plan, which makes no sense because we just established it earlier this year as part of our comp plan. So really, people are concerned we're going to go into a manufacturing and limit their allowable uses can rest easy. We really would not be doing that. However, properties north of the area that we initially designated, or right along the northern border, 2 property owners have already agreed to be included that weren't initially included because they own office buildings and they are seeing a trend towards the demand for office space going down while the demand for housing is going up. And they love the idea of being able to do first floor residential in those buildings to maintain viability. So 2 have said, count 3 of my buildings in and another gentleman. So we have 4 additional properties that are going to be included voluntarily because they're excited about this possibility, possibly a 5th. But so again, you've got, it's a very mixed, no pun intended, result that some people say, hey, what are you trying to limit my uses? But others are ecstatic about this idea that they have more flexibility of what they can do. And they're saying, please let me be included. We say, sure, we'll include you. So
It's great.
Yeah.
It was a good meeting.
it was a good meeting.
And would you note one of the businesses that is on a conditional situation?
Breadtopia.
I think that's an
Yep.
important point.
So, yeah, Breadtopia, you want to talk about?
Yeah, so Breadtopia, excuse me.
I'm going to catch your breath.
No, go ahead.
All right, so Breadtopia is currently in an M2 zone. I think there's something going around here. So Breadtopia is in an M2 zone. which means they can't do certain commercial, they can't sell directly to the public, and they can't even do educational classes, two things they want to do. So what they got was a conditional use permit that lasts for 2 years that enables them to do that with the hope that by then, or before then, this mixed use is established, and then they don't need that conditional use permit because the code will allow them to do what they're doing. So they've got temporary permission, but it would be really problematic for them, say the mixed use didn't go through. So obviously they're hoping it does, but they're one of the properties that we really saw as that could really benefit from this new mixed use development because of their
Because of the size,
So,
the
yeah.
location, changing in industrial uses, that building's not going to become the building it was 20 years ago. It's not going to house the same type of industry. So it's a good opportunity to try something new and keep that building occupied rather than let it stand empty.
So they're going to put in, or they already put in several commercial kitchens that people can rent. So it's becoming this great incubator for new businesses. They've got all this space to work with and a lot of ideas. So we want to unleash that by taking these zoning restrictions that maybe they made sense when they were put in place, but they don't anymore. It's not Harper Brush, it's something new. So we're really excited, but want to take the process a little slower. We're going to do the formal meeting in January and then try to bring this to council in February. But because of that feedback, we said, all right, let's just hold off. We'll do another informal meeting in January, get more input, and then bring a final version of the code to a formal meeting in February. And if everything lines up, then we'll bring something to council in March. So we slowed things down by a month, but it doesn't hurt to allow more time for input. We want to hear from people.
Great.
So call Melanie.
Yeah, exactly. We understand that not everyone wants to come to a public meeting, and and lots of different things the city has going on. City staff is available to talk with people on the phone. We can one-on-one meetings, Zoom meetings, whatever we need to do in order to make sure that people's thoughts are heard during this time.
Thank you. Okay. I think that's all for committee minutes, administrator and department reports.
The only thing I have is talking about the downtown street lighting project. Had a conversation with David Vollmer, who would advise that all of our retrofitted inserts are now installed. The only thing left with our downtown lighting is the light poles that are on the county
Main Street.
office. Courthouse, thank you. Courthouse property. There's one on the south side and then there's one on the west side. So those have to be, I would assume, energized because they're the newer poles, so they have to be energized, but that's the last part of the downtown street lighting project that has to be done. That's all I have.
All right. Okay. I'll entertain a motion to adjourn.
So moved.
Moved by Toohill. Second by Ham. All those in favor say aye.
Aye.
All those opposed, same sign. Meeting adjourned.